Question 1. Vaccine hesitancy and public health communication. A new vaccine for a contagious disease is developed and approved for public use. However, many people in the community refuse to get vaccinated due to concerns about long-term side effects and government involvement. As a result, the disease continues to spread, causing preventable hospitalizations and deaths. Which public health approach would be most effective in increasing vaccine acceptance? A. Mandating vaccinations for all citizens, regardless of their beliefs. B. Partnering with community leaders and healthcare professionals to provide transparent, evidence-based information. C. Banning social media discussions about vaccine concerns to stop misinformation from spreading. D. Offering financial incentives to people who get vaccinated. Answer: B. Partnering with community leaders and healthcare professionals to provide transparent, evidence-based information. Explanation: mistrust in vaccines often stems from lack of information or misinformation. Mandates A. can cause resistance if people feel forced. Censorship C. may increase suspicion rather than change opinions. Incentives D. can help, but trust and education are more effective for long-term public health success. Public strategies should focus on clear, honest communication with trusted community figures. Question 2. Scenario-based question. Field epidemiology and outbreak investigation. Dr. Sanchez, an epidemiologist in major metropolitan health department, is notified of sudden increase in cases of severe respiratory illness among workers at textile factory. The symptoms include persistent cough, fever, and shortness of breath. Early investigation shows that all affected workers have been exposed to new chemical used in the dyeing process. However, some workers exposed to the same chemical have not developed symptoms. Dr. Sanchez needs to determine whether this outbreak is linked to the chemical exposure and what actions should be taken next. What is the most appropriate step in the outbreak investigation? A. Conduct case control study to compare exposures between affected and unaffected workers. B. Immediately ban the use of the chemical until further research is conducted. C. Assume that the chemical is the cause and issue public health warning. D. Wait for more cases to be reported before initiating an investigation. Answer A. Conduct the case control study to compare exposures between affected and unaffected workers. Explanation: an outbreak investigation follows a structured approach, and determining causation requires systematic data collection and analysis. The most appropriate next step is to conduct a case control study, which is effective in identifying associations between exposure, the new chemical, and disease. Respiratory illness. Option B. Ban the chemical immediately may be premature without sufficient evidence linking it to the outbreak. Regulatory action should be based on confirmed epidemiological data. Option C. Issue a public health warning without confirmation could cause unnecessary panic and disrupt operations without definitive proof of causality. Option D. Wait for more cases before investigating is inappropriate because early intervention can prevent further illness. Delaying action contradicts the fundamental principles of outbreak investigation. The CDC's 10 steps of outbreak investigation emphasize early case definition, hypothesis generation, and analytic epidemiologic studies like case control designs to establish causation. Question 3. Social and behavioral epidemiology. Health disparities and policy implications. Study finds that two neighboring communities have significantly different rates of obesity despite similar socioeconomic conditions. Community has 40% obesity prevalence, whereas Community B has only 15%. Upon further investigation, researchers discover that Community has significantly fewer grocery stores offering fresh produce, limited public parks, and fewer opportunities for physical activity. Based on this information, what is the most likely underlying factor contributing to the health disparity? A. Genetic predisposition to obesity in Community A. B. Poor individual lifestyle choices among residents of Community A. C. Social determinants of health affecting access to healthy foods and physical activity. D. Reporting bias in obesity prevalence data. Answer: C. Social determinants of health affecting access to healthy foods and physical activity. Explanation: social determinants of health (ESTO) refer to non-medical factors influencing health outcomes such as access to nutritious food, safe environments, education, and healthcare. In this scenario, Community high obesity rates are linked to limited access to healthy food and fewer opportunities for exercise, which are well-documented contributors. Obesity disparities. Option: genetic predisposition is unlikely to be the primary reason for the disparity, as genetic traits are distributed randomly and would not differ so sharply between two geographically close communities. Option B: poor lifestyle choices oversimplifies the issue, while individual behavior plays a role. Environmental factors and community resources shape health decisions. Option D: reporting bias is not supported by the given data and would require evidence of systemic misclassification. This aligns with WHO and CDC guidelines on ESTO, which emphasize the impact of food deserts, built environments, and socioeconomic conditions on public health outcomes. Addressing these disparities requires policy interventions such as increasing access to healthy food, improving urban planning, and promoting health education. Question 4. Study design selection in occupational epidemiology. A research team is investigating the long-term effects of exposure to airborne silica dust on the development of chronic obstructive pulmonary disease, COPD, among construction workers. The team has access to extensive employment records and medical histories for workers who have been in the industry for over 30 years. They are considering different study designs to assess the causal relationship between silica exposure and COPD. Which of the following study designs would be the most appropriate for this research, and why? A. Cross-sectional study. B. Case control study. C. Cohort study. D. Randomized controlled trial. Answer: C. Cohort study. Explanation: cross-sectional study A would only provide a snapshot of the association between silica exposure and COPD at a single point in time, making it difficult to establish a temporal relationship between exposure and disease. Case control study B is useful for studying rare diseases and would be more efficient in terms of time and cost. However, because silica exposure is well documented in work history records, cohort study is preferable to directly measure incidence rates over time. Cohort study C. Correct answer: follows workers over time, allowing researchers to establish a clear cause and effect relationship between exposure and disease while calculating incidence rates. Randomized controlled trial D is not feasible in this case, as it would be unethical to randomly expose individuals to silica dust for research purposes. According to epidemiology principles, prospective cohort studies are the gold standard for evaluating chronic disease risk factors when exposure data is available. The study should account for potential confounders such as smoking history, occupational protective measures, and pre-existing conditions. Question 5. Health equity and access to care. A study finds that patients from low-income communities experience higher rates of preventable diseases than those from wealthier areas. The primary causes include limited access to healthcare facilities, high cost of medical services, lack of health education. Which policy change would be most effective in reducing these health disparities? A. Expanding public transportation routes to make healthcare facilities more accessible. B. Increasing the number of private hospitals in low-income areas. C. Requiring all doctors to work in underserved areas for at least 5 years. D. Implementing universal healthcare coverage for preventive services. Answer D. Implementing universal healthcare coverage for preventive services. Explanation: preventive care reduces long-term healthcare costs and improves outcomes. Public transportation A helps but does not eliminate cost barriers. Private hospitals B focus on profit and may not provide affordable care. Mandatory doctor assignments C can lead to short-term solutions, but retention is difficult. Expanding affordable preventive care is the long-term strategy for reducing health disparities. Question 6. Scenario-based. Outbreak investigation. Dr. Emily Carter, an epidemiologist at State Health Department, is notified of sudden outbreak of severe gastrointestinal illness at local university. Over 150 students report symptoms of vomiting, diarrhea, and abdominal cramps within 48-hour period. Preliminary interviews suggest that most affected individuals had attended campus event where catered food was served. Dr. Carter must quickly determine the most likely cause of the outbreak and implement control measures. What should be her first step in investigating this outbreak? A. Immediately issue public health warning advising against all catered food at the university. B. Conduct case control study comparing those who ate at the event with those who did not. C. Interview affected individuals and establish case definition. D. Begin randomized trial of different treatments for affected individuals. Answer C. Interview affected individuals and establish a case definition. Explanation: A. Issuing a public health warning prematurely could cause unnecessary panic without confirming the source of the outbreak. B. A case control study can be helpful in identifying risk factors but should be conducted only after defining the outbreak parameters. C. Establishing a case definition. Correct answer is the first step in an outbreak investigation. This includes defining the illness, symptoms, and time frame of occurrence, which is critical for collecting, analyzing data. D. Randomized trials are inappropriate during an outbreak because they focus on treatment rather than identifying the source and controlling disease spread. Following standard outbreak investigation protocols, Dr. Carter should define the case definition, collect and analyze epidemiologic data, who, when, where, identify common exposures, food, water, environment, confirm laboratory findings, implement public health interventions. Question 7. Gene-environment interactions in epidemiology. A study examines the relationship between genetic predisposition and air pollution in the development of lung cancer. Researchers identify a specific genetic mutation that increases susceptibility to air pollution-induced DNA damage. The study finds that individuals with this mutation who live in highly polluted areas have a five-fold increased risk of lung cancer compared to without the mutation in the same environment. Which epidemiological concept best explains this interaction? A. Confounding. B. Effect modification. C. Bias. D. Reverse causation. Answer B. Effect modification. Explanation. Confounding A occurs when a third variable distorts the relationship between an exposure and an outcome. However, in this case, the genetic mutation is not the confounder but modifies the risk. Effect modification. B. Correct answer. Occurs when the effect of an exposure, air pollution, on an outcome, lung cancer, differs based on another variable, genetic mutation. This interaction means the risk is depending on genetic susceptibility. Bias. C. refers to systematic errors in study design or data collection, which is not relevant here. Reverse causation. D. would imply that lung cancer is somehow leading to genetic mutation or air pollution exposure, which is incorrect. Studies on gene-environment interactions are crucial for precision medicine as they help identify high-risk populations and inform targeted prevention strategies. E. Stricter pollution regulations for genetically susceptible groups. Question 8. Assessing causal inference in epidemiology. A study investigating the relationship between physical activity and heart disease finds that individuals who engage in moderate to vigorous exercise at least 4 times per week have a 30% lower risk of developing coronary artery disease (CAD) compared to those who are sedentary. The researchers adjust for potential confounders such as age, smoking, diet, and family history of CAD. Which of the following criteria for causality is best demonstrated by this study's findings? A. Biological plausibility. B. Consistency. C. Temporality. D. Dose-response relationship. Answer C. Temporality. Explanation. Biological plausibility. A. Suggests that the observed relationship makes sense based on known biological mechanisms. E. Exercise improves cardiovascular health. However, the study does not explicitly test the biological mechanism. Consistency. B. refers to whether multiple studies across different populations show similar results. This study alone does not establish consistency. Temporality. C. Correct answer means that the exposure exercise occurs before the outcome. Heart disease, a critical requirement for causal inference. Since physical activity precedes development, the study satisfies temporality, making the observed association more likely to be causal. Dose-response relationship. D means that increasing levels of exposure, more exercise, lead to a progressively lower risk of CAD. The study does not specify whether varying exercise intensity results in proportionate risk reduction. Question 9. Statistical power and sample size considerations. A pharmaceutical company is conducting a randomized controlled trial (ET) to compare the effectiveness of a new hypertension drug to a placebo. The study has 80% power to detect a 10 mHg reduction in systolic blood pressure at a significance level of 0.5. However, due to budget constraints, the researchers consider reducing the sample size. Which of the following the most likely consequence of decreasing the sample size? A. Increased risk of type I error, false positive rate. B. Decreased power to detect a significant effect. C. The effect size will increase. D. The study will become less biased. Answer B. Decreased power to detect a significant effect. Explanation. Type I error is determined by the alpha level 0.5 and is not directly affected by sample size. Reducing the sample size mainly affects type O false negatives. Decreased power. B. Correct answer is the main issue. A smaller sample means greater variability, making it harder to detect a real effect even if the drug is effective. Effect size C. Independent of sample size. Effect size is determined by the magnitude of the drug's effect, not by how many people are studied. Bias D typically arises from systematic errors rather than sample size reduction. Smaller sample may increase variability but does not necessarily introduce bias. To maintain statistical power, researchers must ensure adequate sample size, balancing feasibility with scientific rigor. Question 10. Confounding in epidemiology. A study finds that coffee drinkers have a higher risk of lung cancer compared to non-coffee drinkers. However, after adjusting for smoking history, the association between coffee and lung cancer disappears. What does this adjustment suggest? A. Coffee causes lung cancer. B. Smoking is a confounder in the relationship between coffee and lung cancer. C. Coffee has a protective effect against lung cancer. D. The study suffers from selection bias. Answer B. Smoking is a confounder in the relationship between coffee and lung cancer. Explanation. Smoking is a known cause of lung cancer, and coffee drinkers may be more likely to smoke if smoking is associated with both the exposure coffee drinking and the outcome lung cancer. It serves as a confounder, distorting the true relationship. After adjusting for smoking, the association disappears, meaning coffee was not the real risk factor. Smoking was. Selection bias D refers to problem in how study participants were chosen, which is different from confounding. Confounding is major concern in observational studies and highlights the importance of statistical adjustment in epidemiologic research. Question 11. Public health policy and herd immunity. A local government is considering whether to mandate measles vaccination for school-aged children. Epidemiologists estimate that at least 95% vaccination coverage is required to achieve herd immunity and prevent outbreaks. Which of the following best describes herd immunity? A. Immunity that develops only in individuals who have been previously infected. B. A situation where a large enough proportion of the population is immune, protecting those who are not immune. C. The ability of a vaccine to provide lifelong protection. D. A phenomenon that applies only to bacterial infections, not viral infections. Answer B. A situation where a large enough proportion of the population is immune, protecting those who are not immune. Explanation. Herd immunity occurs when a high percentage of the population is vaccinated, reducing disease transmission and indirectly protecting individuals who cannot be vaccinated, e.g. newborns, immunocompromised individuals. Answer O is incorrect because herd immunity does not require prior infection. Answer C is incorrect because herd immunity does not guarantee lifelong protection. Answer D is incorrect because herd immunity applies to both bacterial and viral diseases, e.g. measles, polio, influenza. Herd immunity is a key public health strategy for controlling vaccine-preventable diseases. Question 12. Ethics in medical research. A pharmaceutical company is developing a new cancer treatment. The company decides to test the drug only in developing countries where participants have limited access to healthcare. After the study, the drug is only sold in wealthier nations at a high price, making it unavailable to the participants who helped test it. Which ethical principle is being violated in this situation? A. Beneficence, acting in the best interest of patients. B. Justice, fair distribution of benefits and risks. C. Autonomy, respecting individual choices. D. Veracity, truthfulness in medical practice. Answer B. Justice, fair distribution of benefits and risks. Explanation. Justice ensures that medical research does not exploit vulnerable populations. Beneficence is about ensuring positive outcomes, but the issue here is unfair distribution. Autonomy C applies when individual choices are ignored, but the main concern here is systemic inequality. Veracity D refers to honesty, which is not the core issue here. Ethical research must ensure equal access to the benefits of medical advancements. Question 13. Bias in case control studies. A case control study investigates the association between high-fat diets and colorectal cancer. Cases, patients with colorectal cancer, are recruited from hospitals, while controls, cancer-free individuals, are selected from the general community. Which type of bias is most likely to affect this study? A. Selection bias. B. Recall bias. C. Confounding. D. Observer bias. Answer A. Selection bias. Explanation: selection bias occurs when the method of selecting participants distorts the true relationship between exposure and outcome. In this study, cases come from hospitals, while controls come from the general population, which may not be comparable. Hospitalized patients may have different dietary habits compared to the general population, leading to a biased estimate of association. To minimize selection, cases and controls should come from the same population base. Question 14. Public health crisis management. A toxic chemical spill occurs in a major city, contaminating the drinking water supply. Thousands of residents are exposed, leading to severe health complications. Many report symptoms like nausea, respiratory problems, and skin irritation. Which immediate public health action should be prioritized to protect the population? A. Conducting a long-term study to assess the effects of the chemical exposure. B. Issuing a public warning, providing clean water, and setting up emergency medical response teams. C. Prosecuting the company responsible for the spill before taking public health action. D. Advising residents to continue using the water but boil it first. Answer B. Issuing a public warning, providing clean water, and setting up emergency medical response teams. Explanation: the first priority in a public health emergency is protecting people from further harm. Long-term studies are important but do not address the immediate crisis. Legal action, C, can come later, but saving lives is more urgent. Boiling water, D, may not remove toxic chemicals, making it an unsafe recommendation. Public responses must focus on immediate containment and mitigation strategies. Question 15. Global health and infectious disease control. A new strain of drug-resistant tuberculosis (TB) is spreading rapidly in multiple countries. International health experts warn that, if no action is taken, the outbreak could become a global pandemic. Which international public health strategy would be most effective in preventing the spread of drug-resistant TB? A. Restricting international travel from affected countries. B. Providing widespread screening, treatment access, and antibiotic stewardship programs. C. Encouraging affected countries to handle the crisis on their own to respect national sovereignty. D. Allowing only wealthy countries to access the newest TB treatments. Answer: B. Providing widespread screening, treatment access, and antibiotic stewardship programs. Explanation: global cooperation is essential to contain infectious diseases. Restricting travel may delay spread but does not eliminate the disease, leaving countries to handle the crisis alone. C. Leads to uncontrolled outbreaks. Unequal access to treatment. D. Violates global health ethics and increases long-term risk. A coordinate, science-based approach is crucial to preventing pandemics. Question 16. Ethical dilemmas in end-of-life care. A 70-year-old patient with terminal cancer is in severe pain and has only a few weeks to live. The patient has expressed a clear, consistent wish to discontinue treatment and enter hospice care for comfort. However, the patient's family strongly opposes this decision, insisting that doctors continue aggressive treatment. As the patient's physician, which ethical principle should guide your decision? Autonomy. Respecting the patient's informed decision to stop treatment. B. Beneficence. Doing everything possible to extend the patient's life. C. Non-malfeasance. Avoiding harm by continuing treatment even if it causes suffering. D. Justice. Prioritizing the needs of the healthcare system over the individual patient. Answer A. Autonomy. Respecting the patient's informed decision to stop treatment. Explanation: autonomy ensures that patients have the right to make decisions about their own healthcare even if their family disagrees. Beneficence. B. Supports doing good, but forcing unwanted treatment violates patient rights. Non-maleficence. C. Means avoiding harm, but aggressive treatment in terminal case may cause more suffering. Justice. D. Is about fair distribution, but this case is about individual choice, not system-wide policies. In end-of-life care, respecting competent patients' wishes is fundamental ethical obligation. Question 17. Lead time bias in screening. A new screening program for prostate cancer detects tumors 5 years earlier than usual diagnostic methods. However, there is no change in overall survival. Which type of bias is most likely present? A. Lead time bias. B. Selection bias. C. Lead time bias. D. Detection bias. Answer: C. Lead time bias. Explanation: lead time bias occurs when a screening test detects disease earlier without improving survival. Patients appear to live longer after diagnosis, but actual survival remains the same. This is why survival should be measured from disease onset, not diagnosis date. Question 18. Epidemiologic transition. Which of the following best describes the epidemiologic transition model? A. The shift from infectious diseases to chronic diseases as leading causes of death. B. The rapid spread of emerging infectious diseases in developed countries. C. The increasing mortality from non-communicable diseases in low-income countries. D. The impact of antimicrobial resistance on global health. Answer A. The shift from infectious diseases to chronic diseases as leading causes of death. Explanation. As societies develop, infectious diseases decline, while chronic diseases, heart disease, diabetes, cancer, become leading causes of death. This is driven by better sanitation, vaccines, and healthcare improvements. Question 19. Public health intervention and cost effectiveness. A country considers mandate HEV vaccination for all adolescents to prevent cervical cancer. Which of the following is the primary justification for this policy? A. HPV vaccination is cost-effective in preventing future cervical cancer treatment, but HPV infection is 100% fatal without vaccination. C. The vaccine guarantees lifelong immunity. D. No other preventive measures exist for cervical cancer. Answer A. HPV vaccination is cost-effective in preventing future cervical cancer treatment. Explanation. HPV vaccination reduces cervical cancer risk, lowering long-term treatment costs. Answer B is incorrect because HPV infection does not have 100% mortality. Answer C is incorrect because boosters may be required. Answer D is incorrect because pap smears are another preventive measure. Question 20. Public health response to an emerging infectious disease. A previously unknown virus has been detected in a small rural community, causing severe respiratory illness in affected individuals. The virus is suspected to be zoonotic, originating from animals, and has already spread to neighboring towns. The local hospital is overwhelmed, and public health officials are working urgently to contain the outbreak. As an epidemiologist, what's your top priority in the initial response phase? A. Conducting a randomized controlled trial to test potential treatments. B. Implementing quarantine and isolation measures to limit further spread. C. Focusing on vaccine development as the primary containment strategy. D. Releasing all case data to the public immediately without verification. Answer B. Implementing quarantine and isolation measures to limit further spread. Explanation. Quarantine and isolation B are essential first-line measures in infectious disease containment to prevent further transmission while epidemiologists investigate the source and assess the virus's characteristics. Randomized controlled trials A are crucial for treatment development but not an immediate containment strategy in an emerging outbreak. Vaccine development C is critical for long-term control, but in new outbreak it takes time to create and distribute an effective vaccine. Releasing unverified case data D can cause panic, misinformation, and public distrust, so information must be carefully managed through official public health channels. D. CDC, who this scenario aligns with who in CDC outbreak response protocols emphasizing containment, surveillance, and epidemiologic investigation before treatment and vaccine strategies can be fully developed. Question 21. Social determinants of health. A public health team is evaluating why infant mortality rates remain high in a low-income urban neighborhood despite improved access to healthcare facilities. Upon investigation, they find that many residents lack stable housing. Local grocery stores offer few fresh fruits and vegetables. Unemployment and poverty rates are higher than in other parts of the city. Parents often work multiple jobs, leaving them little time for child healthcare visits. Which public health concept best explains why infant mortality rates remain high in this community? A. Health belief model. B. Social determinants of health. C. Biomedical model of disease. D. Herd immunity. Answer B. Social determinants of health. Explanation. Social determinants of health (ESTO) include factors like housing, food access, employment, education, and income, which affect health outcomes. Now, even with healthcare access, poverty, food insecurity, and unstable housing contribute to poor infant health. The health belief model A focuses on individual behavior change rather than structural barriers. The biomedical model C emphasizes disease pathology, ignoring social factors. Herd immunity D relates to infectious disease control, not social factors. Question 22. Health communication and misinformation. During a flu outbreak, public health officials release a campaign promoting vaccination. Despite their efforts, many people refuse the vaccine, citing misinformation spread on social media, including The flu vaccine causes the flu. The vaccines contain toxic chemicals that harm the body, and natural immunity is better than vaccination. Which public health strategy would be most effective? Addressing vaccine hesitancy in this situation. A. Mandating vaccination for all adults. B. Using community leaders and trusted healthcare providers to communicate accurate vaccine information. C. Avoiding direct confrontation with misinformation to prevent controversy. D. Increasing access to alternative treatments, such as herbal medicine. Answer: B. Using community leaders and trusted healthcare providers to communicate accurate vaccine information. Explanation: Studies show that trust in healthcare providers and community leaders increases vaccine acceptance. Mandates may be legally or ethically challenging and could increase resistance. Ignoring misinformation. C. Allows it to spread unchecked. Alternative treatments. D. Do not replace vaccines in preventing infectious diseases. Health campaigns must use trusted messengers and clear, evidence-based communication. Question 23. Ethical dilemmas in public health. A deadly infectious disease outbreak spreads in a city. Public health officials propose quarantining individuals exposed to the virus, even if they do not yet show symptoms. However, some individuals refuse, arguing that forced quarantine violates their personal freedoms. Which ethical principle best justifies the public health decision to enforce quarantine? A. Beneficence promoting well-being of individuals over the community. B. Justice ensuring fair access to healthcare resources for all individuals. C. Autonomy respecting individual rights over government authority. D. The harm principle restricting individual freedoms to prevent harm to others. Answer: D. The harm principle restricting individual freedoms to prevent harm to others. Explanation: The harm principle states that an individual's rights can be limited if their actions endanger others. Quarantine protects the community by preventing further spread of the disease. Beneficence focuses on helping individuals, but public health must balance individual and community needs. Justice B ensures fairness, but this scenario is risk containment. Autonomy C is important, but not absolute when public safety is at risk. Public health ethics prioritize minimizing harm to the greater population. Question 24. Global health and emerging diseases. A new zoonotic virus, one that originates in animals, emerges in a rural region with high human-wildlife contact. Scientists discover that the virus spreads from bats to humans and then from person to person. Which of the following public health responses is most important in preventing future pandemics from similar viruses? A. Restricting all international travel indefinitely. B. Strengthening global disease surveillance and early detection systems. C. Implementing mandatory lockdowns in affected countries. D. Relying on natural herd immunity to stop viral spread. Answer: B. Strengthening global disease surveillance and early detection systems. Explanation: Early detection and surveillance help public health officials identify outbreaks quickly, preventing pandemics. Restricting international travel can slow spread but is not sustainable long term. Lockdowns C. Control outbreaks but do not prevent future pandemics. Herd immunity D. For new viruses can lead to high mortality before immunity develops. Investing in global surveillance B is the best long-term prevention strategy. Question 25. Climate change and public health. A recent heat wave leads to a spike in heat-related illnesses and deaths, particularly among elderly individuals and people with chronic conditions. Public health officials warn that climate change is increasing the frequency and severity of heat waves. Which of the following public health interventions would be most effective in reducing heat-related deaths in vulnerable populations? A. Encouraging people to use more air conditioning even if it increases energy consumption. B. Relocating elderly residents from cities to rural areas where temperatures are lower. C. Establishing community cooling centers and improving heat wave early warning systems. D. Increasing government subsidies for bottled water to prevent dehydration. Answer: C. Establishing community cooling centers and improving heat wave early warning systems. Explanation: Cooling centers provide a safe, air-conditioned space for vulnerable populations during heat waves. Early warning systems allow cities to take action before extreme heat causes deaths. Using more air conditioning increases energy demand and is not accessible to all residents. Relocating elderly B is not a practical solution. Bottled water subsidies D help with hydration but do not directly prevent heat-related deaths. Climate change adaptation requires structural and community-based solutions to protect at-risk populations. Question 26. Ethical decision-making in public health. A pharmaceutical company develops a promising new vaccine for a deadly infectious disease. However, the vaccine is expensive and the company prioritizes selling it to wealthy nations rather than distributing it to low-income countries where the disease is more widespread. Which ethical principle is being violated in this scenario? A. Non-maleficence. Do no harm. B. Justice, fair distribution of resources. C. Autonomy, respecting individual choices. D. Fidelity, keeping promises and maintaining trust. Answer: B. Justice, fair distribution of resources. Explanation: the principle of justice ensures that healthcare resources, including vaccines, are fairly distributed based on need, not wealth. Non-maleficence they applies when harm is directly inflicted, but this case involves unequal access. Autonomy, C, focuses on individual choice, but this issue is about systemic inequity. Fidelity, D, relates to trust, but justice is the core concern. Global health policies should prioritize equitable vaccine distribution. Question 27. Health communication and misinformation. A high-profile celebrity publicly claims that a certain herbal supplement can cure cancer, despite no scientific evidence supporting this claim. As a result, many cancer patients stop their prescribed treatments and turn to the supplement instead. Which public health strategy would be the most effective response to combat this misinformation? A. Ignoring the claim to avoid giving it more attention. B. Partnering with oncologists and trusted healthcare providers to provide accurate, evidence-based information. C. Banning the supplement from being sold, regardless of legal consequences. D. Launching an aggressive social media campaign calling the celebrity a liar. Answer: B. Partnering with oncologists and trusted healthcare providers to provide accurate, evidence-based information. Explanation: misinformation spreads rapidly, but the best way to counter is through trusted experts. Ignoring the claim, A, allows misinformation to spread unchecked. Banning the supplement, C, may not be legally enforceable and could increase demand. Attacking the celebrity, D, can backfire by making the issue seem personal rather than scientific. Public health campaigns must focus on clear, science-backed communication. Question 28. Environmental health and air pollution. A large factory in an urban area emits high levels of air pollution, leading to an increase in respiratory illnesses, such as asthma and bronchitis, among nearby residents. Studies confirm that exposure to the factory's emissions is significantly harming public health. Which policy intervention would be most effective in reducing long-term health impacts on the community? A. Providing free inhalers to all residents living near the factory. B. Relocating people with asthma to other areas with better air quality. C. Enforcing stricter environmental regulations on the factory to reduce emissions. D. Encouraging residents to stay indoors and wear masks when outside. Answer: C. Enforcing stricter environmental regulations on the factory to reduce emissions. Explanation: the most effective solution is addressing the source of pollution rather than just treating the symptoms. Free inhalers help individuals but do not stop the root cause of pollution. Relocating residents, B, is impractical and does not solve the systemic issue. Wearing masks, D, provides temporary protection but does not eliminate pollution. Exposure. Environmental policies should focus on prevention and long-term solutions. Question 29. Public health and health disparities. In a rural community, African American women experience significantly higher maternal mortality rates than women from other racial groups. A study finds that many women report feeling ignored by doctors. Healthcare facilities in the area are underfunded and understaffed. Transportation barriers prevent access to prenatal care. Which public health approach would be most effective in reducing maternal mortality disparities in this community? A. Increasing the number of high-risk pregnancy specialists in urban hospitals. B. Expanding Medicaid to cover more pregnancy-related services. C. Training healthcare providers on implicit bias and culturally competent care. D. Encouraging women to give birth at home with midwives instead of hospitals. Answer: C. Training healthcare providers on implicit bias and culturally competent care. Explanation: implicit bias in healthcare can lead to low quality treatment for marginalized communities. Expanding Medicaid, B, increases access but does not address provider bias. Urban hospitals, A, do not solve the issue in rural areas. Home births, D, can be risky without proper medical support. Addressing implicit bias improves maternal health equity. Question 30. Infectious disease outbreak management. A new strain of antibiotic-resistant bacteria has emerged in multiple hospitals. Public health officials find that overuse of antibiotics in both hospitals and agriculture has contributed to this resistance. Which long-term public health strategy would be most effective in reducing antibiotic resistance? A. Encouraging doctors to prescribe antibiotics for all infections to prevent complications. B. Promoting research and development of new antibiotics. C. Banning all antibiotic use in farming and agriculture. D. Educating healthcare professionals and the public about appropriate antibiotic use. Answer D. Educating healthcare professionals and the public about appropriate antibiotic use. Explanation. Antibiotic resistance occurs when antibiotics are overused or misused. Prescribing more antibiotics, A, worsens resistance. Developing new antibiotics, B, is helpful but not a long-term solution if overuse continues. Banning antibiotics in farming, C, may not be feasible without alternative solutions. Public health efforts should on responsible antibiotic use and education.